What's up, everybody? Welcome back to Paramedic's World. It's been a while. I know, been busy. It's been holidays, New Year's, a lot of things changing, a lot of things going on. But today, we're going to drink some coffee. Got it right here. Nice big cup. We're going to talk about some chest trauma and a couple quick fixes. If you guys have been catching all the Stop the Bleed stuff, or anyone combat medics, done TCCC courses, SWAT medics, probably already know about this stuff, but it's always a good thing to practice because it doesn't happen too much, or hopefully not too much in the EMS field, but it is good tools, quick tools, and a couple techniques we'll go over. So we're going to be going over some needle decompression. Got two different needles we're going to talk about, both 14 gauge needles. And we're going to talk about the chest seals. All right. So the two types of trauma we're going to talk about is your sucking chest wounds and your tension pneumos. Your sucking chest wounds can turn into having pneumothorax also. So we're going to go over the basic steps to treat your sucking chest wounds first, and then move into the needle decompression for your tension pneumos after that. So what we're going to be looking for initially is any type of chest trauma or a mechanism of injury that can create chest trauma, such as blast injuries, blunt traumas from car accidents, baseball bats, kick from a horse, several different things out there, falls, so and so. But you also got to remember, you also have your individuals, your tall, slender people. They can get the spontaneous pneumothorax as well. But some criteria that we're going to look at for the treatment of tension pneumo and hemopneumo is all going to be pretty similar. Really for, first of all, do we have any visible trauma, any bleeds, anything penetrating? And that's anywhere around the torso. So we got to make sure we check front and back. So what we're looking for, respiratory distress, increase or decrease in your rate of breathing, absent or markedly decreased breath sounds on the affected side, or it could be both sides. So make sure we're checking both. We're also looking at pulse ox levels, anything below 90, or any type of shock vital signs, so your markedly low blood pressures, high or low pulse rates, and as well as some types of traumatic arrests. We're also going to consider some decompression as well. So tools we got here, Hyphen chest seal, a couple different brands out there. This is just what we use. Comes in a 2-pack, and that's going to be for front and back. And then you have your two different needles. You could also use a 14 gauge, 3 1/4 inch regular IV catheter as well. We just have commercial decompression needles. One by H&H, one's North American Rescue. You got your enhanced needle, and this is more similar like a regular needle over catheter IV. So what we're looking for, and no demonstrators today, just got my nice little chest tummy. We're looking for some type of penetrating trauma, and I'll just mark it with a little marker, and we'll say that's our area of concern. Now we'll call this a gunshot wound. So this patient right here, gunshot wound to the chest, right? Anything in the chest, we can't pack, we can't do anything else. We're worried about air building up, from causing tension pneumo, and that's going to create pressure, causing the lung to collapse, and also eventually cause a shift and shut off some of the major arteries over the heart, compress the heart, can shut everything down. So simple fix is using your Hyphen chest seal. It comes in a 2-pack, like I said, for front and back. So we got to make sure we don't have any trauma on the back. We don't have any trauma here, so that's good. So we're just paying attention to the front today. Go ahead and rip your pack open. All right, nice little commercial device. Comes with a gauze. All right, now if there is any type of oozing, bleeding, you're going to take your gauze, you're going to wipe that off first. All right. Next, take your chest seal, pull it apart. All right, so the center of this is going to go right over the center of the wound. Make sure you go ahead and make sure it sticks. All right. These channels are going to allow it to burp itself. That way, any type of pressure buildup in there is going to release. If it does look like there's excessive pressure buildup or there's more blood oozing out of there, stopping the air from getting out, we can always go back to the older methods of burping. So you just simply take the part, take the end, pull it over, take some more gauze, wipe the excess blood, allow it to burp, and then simply put it back on. This does stick pretty good over hair from a use of experience. If you have multiple gunshot wounds, you can always cut this into quarters and then go back to the old methods of just putting it on, taping 3 sides, burping as needed. Once this is on, we're always going to recheck vitals, make sure the treatment worked. Going further, depending on the injury, it could be in association with a hemopneumo, or it could be a tension pneumo. All right, so tension, the type of events we're going to look for, any type of blunt trauma, could be from your bad car accidents, assaults, maybe got hit by a bat, maybe fell off a horse, got kicked. Several things out there, use your imagination. I'm sure we've seen it. Right here we have the H&H enhanced pneumothorax needle. All right, difference between this and your old school needles. This is not like the IV catheter over needle. This is just a all-in-one design. All right, so it's gonna be the same location. We'll go over that as we before, but this needle, just get it in place. It's gonna relieve the pressure and help you save that life. All right, so the first landmark that we're going to look for is going to be your second intercostal space, mid-clavicular, but lateral from the nipple line. All right, you don't want to be inside the nipple line, because that's going to put you towards greater vessels and potentially the heart, depending on which side you're on. The way to identify the second intercostal space is to first start along the clavicle line. Right, that first space below, that's going to be your first intercostal space. All right, so the clavicle line is about here. First below is over here. All right, then you're gonna run your fingers down to the next rib. That's your second rib. All right, then you have your second intercostal space. So the nipple line is gonna be over here. We're gonna say just lateral to that, and we're gonna go just above the third rib, and that's gonna be a 90-degree angle, so straight down towards the back. All right, essentially your patient should be laying down flat on their back. That way you have a good measurement to go 90 degrees. All right, some tricks too. When they're laying down, if they're got a thick chest or muscular chest, just try and get their arm out to the side. Stretch out that muscle as best you can. That way you have a better capability of feeling the bones themselves. All right, so Chris is going to go ahead and demonstrate this. All right, you can identify his landmark. First feel for that clavicle. Go to the first space, down to the second space. All right, make sure you're just lateral to the nipple line. So you want to end up right over here. Nipple line on this mannequin is marked right over here, so he's going to end up just over here. All right, so this is the H&H enhanced pneumothorax needle. Make that 90-degree insertion. Once he's down, he's going to hold it in place for 5 to 10 seconds. That's going to allow for full decompression. You would do the same thing if you're using the catheter over needle. All right, so before you remove that needle, leave the catheter in place, make sure you're there for about 5-10 seconds. You hear the hiss of air. Once that's complete, you're going to make sure you go ahead and recheck all vital signs, SpO2, lung sounds, and as well as make sure level of consciousness hasn't changed. Mark any decreases as necessary. All right. The references for this training is going to be in PHTLS. You can also look up the TCCC guidelines from NREMT. A good website to look at is deployedmedicine.com. That's also they got great videos over there, good content, and a lot of tactical casualty care guidelines, videos, training documents. That's constantly being updated to the newest guidelines and standards. And we'll catch you next time. Hopefully next time when you see us, we're talking about CAT tourniquets, emergency trauma manages, and some quick clot. So this month is going to be all about stop the bleed, get those things going. And further on than that, what we're looking at is we're going to be getting our ALS team back together. So if any of you out there do paramedic competitions, those go on, I'm pretty sure, a little bit everywhere. There's some big ones out there. Different countries do it. I suggest you get involved in that kind of stuff. Makes you a better medic. It's also good to collaborate with other departments and teams, learn what they're doing, how they're treating patients. It's a great place to do some networking. No one's done ALS competitions like being back at paramedic school, going through your whole patient assessments and treatments based on the books. So it takes a lot of thought process. So I'm gonna try and get some vlog going on that. We got our next competition coming up in April at the Palm Beach College, the EMS Panther Challenge. My team's been competing for about 3 or 4 years now. We're not the best, but it's always there for improvement, and it makes us better at the end of the day because we always learn something new. So thanks for watching. Hit that subscribe button. Catch you next time. Enjoy that coffee. Have a good shift. Catch y'all later.